Transcranial direct current stimulation is a neuromodularity technique that delivers low intensity and direct currents to cortical areas, facilitating or inhibiting spontaneous neural activity. This technique involves two kinds of stimulation that flows between electrodes placed over the scalp with resultant polarity-specific changes in neuronal excitability, and these are called anodal and cathodal stimulation. Anodal stimulation increases neuronal excitability, whereas cathodal stimulation decreases neuronal excitability. Transcranial direct current stimulation has generated interest as a treatment modality for schizophrenia, as alterations of neuroplasticity and cortical excitability are important pathophysiological factors in many neuropsychiatric diseases. Thus, to modify cortical activities by using non-invasive brain stimulation might be a valuable therapeutic approach. Schizophrenia is a major mental health disorder characterized by psychotic symptoms and cognitive deficits, which has a massive effect on the individual's health state and quality of life. Antipsychotics are the first-line treatment for schizophrenia. However, it is estimated around 10 to 30% of patients with schizophrenia show little or no response to antipsychotics, and another 30% experience residual symptoms despite the antipsychotic treatment. A study on examining transcranial direct current stimulation as a treatment for schizophrenia in 2012 involved patients receiving the anodal stimulation placed over the left dorsolateral prefrontal cortex and the cathodal stimulation over the left temporal-parietal cortex. The left dorsolateral prefrontal cortex is located in the middle frontal gyrus, and this physiological mechanism was selected to receive the anodal stimulation, as it is primarily associated with language processing and other executive functions, including working memory and selective attention, and this has been previously shown to reduce negative schizophrenic symptoms. The left temporal-parietal cortex is located where the temporal and parietal lobes meet on the brain's left hemisphere, near the lateral sulcus. And this physiological mechanism was selected to receive the cathodal stimulation due to this region being primarily associated with speech perception, language cognition, and processing. This study found that auditory verbal hallucination severity was significantly reduced by 31%, and this beneficial effect lasted for up to 3 months. This can be explained through the system model, which suggests abnormal levels of regional cerebral excitation and inhibition cause refractory to drug treatment. However, the transcranial direct current stimulation assists with modulating cortical excitability to improve this. Brundtland in 2016 conducted a similar study and methodology and focused on the same two physiological mechanisms, with the cathode over the left temporal-parietal junction coupled with the anode over the left dorsolateral prefrontal cortex. And it was found that this treatment decreased the severity of auditory verbal hallucinations, modulated the functional connectivity of the left temporal-parietal junction, and improved self-recognition. Similar findings were also discovered by Ferrucci et al. In 2014. However, this study discovered discrepancies between patients using medications as a form of treatment for schizophrenia. Further research in 2019 with the same stimulation on the left dorsolateral prefrontal cortex and left temporal-parietal junction found there was a positive correlation between the enhancement of cognitive insight, self-reflectiveness, planning ability, and the improvement of higher-order executive functioning among patients treated with transcranial direct current stimulation. In healthy individuals, the left dorsolateral prefrontal cortex and its associated neural circuitry has a heightened ability to adapt and generate efficient planning performance strategies through increased cortical excitability, which strengthens neural synaptic connections, thereby enhancing neural efficiency. Schizophrenia is a major cause of cationa, which is a state of potentially life-threatening psychomotor disorder and behavioral abnormalities. A case study on an individual with cationa in 2020 observed a clinical improvement due to the successful change from electroconvulsive therapy to transcranial direct current stimulation, with the same physiological mechanisms used in the studies discussed earlier. This clinical treatment could be attributed to the delayed response to the original treatment of electroconvulsive therapy, even though the patient felt much better after starting the new treatment. This critique of the case study can be related to the research literature on schizophrenic patients, as previous treatment may have an influence on results. Fitzgerald et al. In 2014 found conflicting findings and discrepancies between the length and frequencies of transcranial direct current stimulation, as while 5 sessions improved cognitive deficits, 10 and 15 sessions did not improve the same deficits significantly from the 5 sessions, which highlights that dosages may represent a parameter that has the potential to improve symptoms of schizophrenia patients. Future research of transcranial direct current stimulation and schizophrenia needs to explore the influences of previous treatments prior to the research, the optimal cumulative doses, treatment frequencies for patients, and the combination treatment strategies, for example, medication, cognitive therapy, and transcranial direct current stimulation. The following listed is required to form a stable and effective treatment plan for this mental disorder for both short term and long term.